Hi fam, as promised I wanted to come on here and talk a little bit about the signs and symptoms of pancreatic cancer and then talk to you a little bit about my particular symptoms. So a lot of people will report abdominal pain. That pain can also be felt in the middle of the back. The pain then could radiate from one side or to the other. They may experience weight loss. Possibly they could be jaundice. That's a yellowing of the eyes or the skin. A way to kind of look at that is you could kind of pull your eye down, and as you can see, you look in the whites of my eyes where it's white, but it could be yellow. That's a good way to see if you're jaundice, other than if you just look, jaundice, your coloring looks a little yellow. Changes in bowel habits, the consistency of the stool, the color of the stool, oily stools. Those are some common symptoms as well. Your stomach may be a little bit more upset than normal. Maybe you're belching a little bit more, or you're a little bit gassier than normal. So my signs and symptoms of pancreatic cancer was started in January, and I talked about that in my earlier introductory video. So I had noticed a change pretty much just one day. I noticed it, and it continued thereafter. The color of the stool was not the typical brown that you think of. It was a lighter color, like a yellowish tannish color. The stool can also be white. I did experience that after I ate a fatty meal. It can also be oily. You could have oily stools, and I experienced that as well if I ate something fried, like a fried chicken or French fries or something like that. You may notice oil that's actually floating in the water, or when you go to wipe, you'll see oil. I didn't have any particular nausea, or I was experiencing some weight loss, but I was actually trying to lose weight. And like I talked about in the video, I had gone to my primary care doctor, and she thought it was just my gallbladder, because those symptoms do overlap with your gallbladder as well, like inability to tolerate fatty foods, oily stools, color of the stools. And all my nursing friends thought the same thing, as well as some provider friends that I have. They were like, it's just your gallbladder. So that's originally why I had gone to my primary care doctor to discuss that. And as I mentioned, I had had that ultrasound of the gallbladder, and it was normal in the bile duct. And my symptoms continued, and I just didn't feel like they were right, because they weren't normal for me. And I mentioned to my family as well, is like I used to always put like blue toilet, make your toilet water blue or purple or things like that, because I liked it. But I didn't have that in the toilets, at the time I was experiencing symptoms, which I think is a good thing, because you may have missed some of the more important things. So my stools were definitely lighter in color. They also floated, so they weren't as bulked up as before and sinking like you would like them to sink. They were floating, so that was alarming to me. As well as I had changed my diet, and I was thinking, well, trying to do maybe a detox type diet. If it was gallstones, try to remove them, naturally. With just eating good, healthy foods. So I'd actually changed my eating habits, and I did lose weight. First I was trying to, and then I was doing it with like a detox cleanse type diet. But what makes me go to the ER is I noticed some yellowing there in my eye, like I talked about, and that was where that bile duct was becoming blocked. And they placed the stent in when they had done the ERCP. So my particular tumor is at the head of the pancreas, and that's what it was doing, is it was starting to kind of compress on that bile duct, and they had to put a stent in. As well as I had mentioned, the urine. My urine had become more of a yellow orangier color, almost looked like you had taken, if you've ever taken vitamins and you've noticed that your urine is brighter. But I wasn't taking any vitamins. So, and it continued to be like that throughout the day. And I was drinking water, trying to flush everything out, because I had been taking a supplement called turmeric. And one of the GI nurse practitioners had said that that is fine to put on your food, but don't take the oral supplement of it. And that's what led me not to go to the emergency room maybe just a few days sooner, was because I thought that's why my urine had changed colors. But really it was just the bile that because the bile duct was starting to get blocked, it was then bile going throughout, you know, your urine, because it was trying to get rid of the excess bile. So that was a really bile. I don't know what I said. If I said bile, but I meant bile. So that was a sign too, as well, you know, that why I end up going to the emergency room, and what led to my diagnosis. So, you know, looking back on it, it definitely, you know, was a journey. I'm grateful that I went to the emergency room and that it was caught early, which oftentimes it's not caught early. So always be mindful of those symptoms, especially if you have like a family history of pancreatic cancer. Definitely advocate for yourself and your loved ones. If you feel like you're going to your primary care doctor and they're saying everything's normal and your symptoms are just persisting, just keep pushing to even recommend them seeing a specialist, perhaps a GI person, and then always, you know, go to the emergency room if things don't seem right, because when things are worked up inpatient, you get those results so much quicker. You're at the hospital and all the doctors, you know, they're there. Like, usually when you're admitted in the hospital, you have a hospitalist and he's an internist, and then there are other disciplines that get involved based on your results. And they're all there together, and the results come back so much more quickly than if you work this stuff up outpatient. So, you know, definitely keep that in mind and just keep pushing and pushing, especially if you think something is not right. You know, trust your gut and don't just be, oh, I'm fine. You know, definitely get that looked at. If you have a family history of it, probably wouldn't be a bad idea to get some kind of genetic counseling, a referral to them, and they can draw some labs and see if you're at an increased risk of getting pancreatic cancer. So I hope you find all this information helpful. If you did, click the like button and definitely spread the word, because we definitely need more awareness for pancreatic cancer. Okay, I hope you all have a good day. Bye for now.